Wellness for Life is brought to you by Sanford Health Clinic and Same Day Surgery Center, Purim Area Community Center, Amy Lundberg, Fitness for the Soul, Gothenburg Chiropractic Clinic, Pelican Drug Health Mart, Mojave Ottawa Community Action Partnership.
Welcome back to Wellness for Life. I am here today with David Gothenburg of Gothenburg Chiropractic Clinic in Pelican Rapids in Menahga. Today we're going to talk about low back pain. David, what can you tell us about this complex issue that so many people struggle with?
Yeah, thanks. You know, there are so many different causes and there are so many different types of low back pain. So today I'm just going to move past disc pain, and I want to talk about that very low joint in the low back called the sacroiliac joint. And this is often a joint that when I ask people to describe it, they describe it as hip pain. But what we really want to talk about is this joint in the very lowest part of the low back.
You had mentioned that that joint is a little bit different. What are some of the common symptoms or complaints that you hear from patients?
Yeah, what I'd like to do is, I think to better understand some of the more common symptoms, probably is a good idea to understand how this joint works. And what I'm talking about is the sacroiliac joint. This is the sacrum, the wedge-shaped bone, and this is the ilium. And so most people don't understand that each and every step that we take, this joint moves, so moves back and forth. So some of the more common types of complaints might be unchanging low back pain that's centered over the SI joint. It may irritate the muscles in the hip or buttock area, so hip or buttock pain. And it's very close to the sciatic nerve, which explains why some people develop leg pain.
So if I understand correctly, the sciatic nerve runs right through that joint?
That's a good question. The sciatic nerve exits very close to the sacroiliac joint, and this nerve then continues down the back of the leg where right behind the knee it splits and then extends all the way to the heel and forefoot.
So what are some things that we do that cause lower back pain?
Some of the more common causes would be working bent at the waist for a long time, long sitting, especially if the chair doesn't fit you correctly, so posture is very important. Your history, in other words, has there been injury? And then the other thing that a lot of people forget about is pregnancy, because in the last 2 or 3 months of the pregnancy, when the body is flooded with progesterone, that causes the ligaments that support the joint to loosen or weaken. And anytime we develop something like that, we develop joint play or instability.
So for a person who's struggling with lower back pain, where do you start with them? How do you begin to treat them?
In addition to really talking to them about their causes, one of the other things that we really want to look at with a person is their gait, even considering whether or not they have a flat instep or short leg. That being said, I really have some strong opinions on how a person should be adjusted and the method to do that adjusting. We offer suggestions on how you sit and should be sitting, how you sleep, some good icing techniques, stretching techniques specifically to the hip and lower back, and finally supporting or bracing the joint.
Thank you for joining us today. If you or someone you know is struggling with lower back pain issues, be sure to stop in and visit with David and see how he can help you. Join us again next time.
Coming up on Wellness for Life.
Hi, I'm Don Perrin, Pelican Drug Pharmacist, and Jenny Field, also Pelican Drug Pharmacist. Today we're going to talk about medication challenges as you age. The Robert Wood Johnson Foundation estimates that 75% of the people over age 65 have more than one chronic health condition. It's common for people in this age group to take multiple medications. How your body responds to medicine changes with age, and about 1/3 of people that are hospitalized in this age group are hospitalized due to health or drug-related problems. Communicating with your doctor or pharmacist can help you stay safe. I'll let Jenny talk to you about taking multiple meds.
Multiple medications is, again, why a lot of people are hospitalized, and it's really important to stay with one pharmacy. If you stay with one pharmacy, we know everything you're taking, and every time we fill a prescription, we can check for drug interactions, and that can help eliminate some of those hospitalizations. And if you're filling at multiple pharmacies, they might not know that you're taking this drug or this drug, and that could lead to problems. We can also help with synchronization. If you've got a lot of different medications and they're all running out at different times of the week or different times of the month, we can help synchronize those so they all run out at the same day every month, and then you only have to make one trip to the pharmacy. And it kind of makes it easier to remember to take them so you don't run out. We can also talk to you about side effects. If it's a lot easier if you're at one pharmacy to talk to one pharmacist about all your medications, and they can look at everything if you start having a problem with something. Another issue is forgetfulness, and Don will talk about that.
We can help you with forgetfulness. You don't remember to take your medicines at a certain time. We can put medicines in a special packaging that tells you what time of day and the day that you're supposed to take it. We have different options available to help you remember to take your medicines. You can also put them in things like pill boxes. You can buy those over the counter, and work on setting up a daily routine so that, if you take your morning medicines when you brush your teeth and your night medicines when you brush your teeth, put the medicines with your toothbrush. Jenny will talk about cost.
Cost is another reason why there's a lot of medication challenges. Fixed incomes is a big issue. We just don't have the money sometimes to buy all of our medications. So talking with Don or I about what your problems are, what medications that are just a little bit out of your budget. We can look at doing a generic that's maybe similar but will save you a lot of money, or maybe optimizing one medication over another. And those can be some big cost-saving things. And then when Medicare open enrollment comes around too, looking at your plan and finding your best option to cover which drugs you take is also really important, and we can help with that too.
A lot of times when you're over 65, you have swallowing or dexterity problems, and the safety caps are meant to be used with people that have children in the home. We can put easy open caps on your containers. The main thing is to remember that most of the poisoning that happens at grandparents' homes when children get into them, so you need to put your medicines up high and out of reach of the children. Also, if some of the pills are large, it's possible we could have liquid medicine, or you could crush it. But before you crush anything or chew a pill, check with your pharmacist to make sure you can do that. If you have any questions about your medications, feel free to contact your pharmacist, and as always, stay healthy.
Thank you for watching Wellness for Life, brought to you by Sanford Health Clinic and Same Day Surgery Center, Parameria Community Center, Amy Lundberg, Fitness for the Soul, Gothenburg Chiropractic Clinic, Pelican Drug Health Mart, Mojave Ottawa Community Action Partnership,